Center for Children and Families is a 501c3 agency. Its mission is to provide quality mental health outpatient services to children and families and in the schools. And we're small. We were about $5 million, had about 100 employees at that time. The challenges are basically competition for dollars, competition with agencies at huge endowments providing the same kinds of services we were. Challenges was to do more with less, which basically I heard from the day I took my position at Mental Health Services or Center for Children and Families. But the biggest challenge was to stay solvent. We had to look at our expenditures, whether it was in service, whether it was in retirement benefits or health benefits. We had to look at other forms of operations, including, do we want to develop a private practice model? And some agencies have spun off and done private practice models. The other thing we did, we looked at merging with another agency. And we had a number of discussions with that agency and decided against that because basically we would have lost our identity within a week or so of having signed the papers. What we really liked was what was going on at Talbert House. Talbert House had already affiliated with another agency, Core Behavioral Health, which became Centerpoint. They had worked out a great arrangement and put it down in writing, so when we talked to Neil and talked to the director from Centerpoint, we could see exactly what we were getting into, and we kind of liked what we were getting into. Talbert House was willing to sign the co-sign with the bank, which we needed at that point. And nobody likes to be in that position, but that's reality. That was the driving force. The other things we liked about the affiliation was it allowed us to tap into Talbert House's resources. They have a tremendous fiscal department. They have a tremendous human resource department. Smaller agencies just don't have the resources to provide the kinds of support that Talbert House has. There are a lot of challenges and downsides to it. One is we had to accept the fact that we were not as solvent as we wanted to be, that we had to lean on another agency, and but fortunately we did find one. The other is there's also a cultural change. You know, staff had been with, some of them had been with me the 30 years that I was there. And they liked what we did, who we were, and they had established themselves in the community. And they did not like having to make that change. But even though they saw the options were limited. Things I had to do is continue to meet with staff and make sure they were part of the initial decision-making process, that there are no secrets out there, as Neil did or will point out, is that communications is so important. You can't do any of this, the CEO can't do any of this without full support of the board. It's a lonely job at the top, whether you're in a small agency or a large agency, and affiliation was not necessarily top on our staff's part. But once we made a decision, and we clearly saw we had to make the decision, the CEO needed that support of the board. So if board members are out there thinking they're just volunteers, they're just hanging around going to meetings, don't think that. They are a real support and can be a real support for the CEO and whoever else is involved with making the change. Once you make the decision to affiliate or merge or whatever, you don't back off. You just go ahead, say this is what we're doing, and don't look for reasons why it's not going to succeed, because it will succeed if you continue. The lessons I would say I learned is that you can't let your ego get involved, that even though I was the director from beginning to end basically, I knew that if we did not affiliate or make some major change like affiliation, the agency was going to cease to exist. We would be bankrupt probably. And that doesn't help me as my ego, it doesn't help anybody. So the fact that we can see the agency continue, even though it's in different form, our staff we're still working. So that was a big part of it. The other part is don't feel that you failed. Failure is not part of the problem. I don't feel that I did not succeed. The times have changed. You look at the hospital systems, how they're merging. You look at how the private practice models, large practice models are merging. Why? Because you can't succeed out there by yourself. As large as we thought we were as an agency, we were very small in terms of the total healthcare, mental health care picture. We needed to affiliate.